Hi, folks. Thank you for watching. I really appreciate your time. And I want to do a quick piece about how to represent your interests when dealing with doctors. So have compiled a list of concepts and questions to take a look at. So I recommend writing this down. Writing things down, it uses like 9,000 parts of your mind, body, energy system, rather than doing screenshots or looking at a webinar. So right now, get a pen and paper, and make sure it's in a journal. So you want to be able to find these pieces of paper and be able to refer to it in the future, because I do that too. I put it on a Post-it, and then I'm like, where the heck is that thing? So you got a pen and paper, you're comfortable, you're able to stick around for a little bit. This is going to be a brief webinar. My intention is to provide a good framework for you to represent your interests, because nobody else is going to do it. People aren't necessarily nice people. Institutions aren't there to necessarily take care of you, and it's your job as an adult to do this. And I'm not saying you haven't done it, and I'm not trying to say you're not an adult. I'm 47 years old, and I've been working with this material for like 10 years, and I'm still trying to figure it out. And I want to share it with anybody who might be of interest or might find it of interest. So the most important thing to start with is, what is your goal? So I am going to begin this portion based on Liz Wheel's book, Winning Every Time. So what is your goal or need? So you go to the doctor, and I am focusing on doctors, and even doctors are ignored by other doctors. If you're not in that specialty, or even if you're in that specialty, it seems like it's this who can disrespect who more. and there's books written about it. So anyways, what is your goal or need? I need further testing, or I need a remedy for this symptom, for instance. So who can help you and when? So, you got to do your homework. You got to know what your issue is, and you're trying to find out who can help you and when they can help you. So maybe I need an endocrinologist or an osteopath or a dentist, and maybe they can help me. It seems like 6 months down the road, or 8 months down the road, when they're available, when they're beginning to have openings. So what's the evidence of what you're dealing with? So you need to have backup. And something that I have learned is that being a patient is this legal issue. It seems like you are there to be questioned and doubted. Like you lack credibility until somehow you've proved you're credible. So you're guilty until proven innocent. That is just how I have found doctors to be. And I'm sorry, doctors, if you're offended by this, but it seems to be the case. So you need to come in with evidence. And even then, doctors are going to possibly ignore this evidence. However, you're doing your due diligence, and that is your job. Your job is to do your due diligence, to get information, to access resources, to represent yourself, not to make that receptionist or that insurance company or that doctor feel happy and like you, because it is your survival and your well-being that is going to miss out, if you're just trying to be nice, because these people are not operating in that be nice place, other than expecting you to be nice to them while they run roughshod over your quality of life, honestly. Anyway, so what is your plan? So you need to have a plan, which we are working on right now, and you need questions to reinforce your position. So So you can ask doctors the following questions that I'm going to present in just a little bit. And another thing is learning how to minimize your emotional experience. Now, I have a history of PTSD, and it's just so complicated and so big, and secondary trauma by my care providers. And so some practitioners, some doctors may be telling you to shut up about it, stop saying it. And I'm like, the reason why I'm saying that this is a constant, I was in this workplace environment that was like a concentration camp, that was like slave labor, is because the test and diagnosis indicated adrenal insufficiency. So to describe accurately the facts of the matter may sound like you're being a crazy maniac. So emotional. And if a doctor can't handle that, just explain, I'm just putting this into context. So, but it is important for you to be a robot and not to have emotions, because this industry is not for human beings, for living, free human beings. And if that's all you got, I'm here to try to help you navigate this so you represent your interests, you get your needs met, you are able to access the resources to allow you to manifest well-being for yourself. That is the goal. What is your story? So you need to be able to illustrate your case to the doctor, to the nurse, even to the gatekeeper, the front desk person. So you need a simple, short, sweet, and simple description of what you're working with, what previous diagnosis that you have, and what you're concerned about. And it seems like it's really important that you play dumb, avoid any indication that you have thought for yourself, and that avoid anything that implies that you have done any self-diagnosis. For some reason, doctors, these people are not mature human beings, unfortunately. Maybe that's why they became like God doctors. And so they're kind of emotional dwarves, spiritual dwarves. And you need, in order to survive, you need to talk their way, unless you can hire a mature adult who's a doctor. And congratulations if you can, because I'm sure that person probably costs like $7,000 an hour. So you need to have a simple story to tell the front desk gatekeeper, the nurse who's going to vet you, and then the doctor. So you need to keep it like 1 to 2 sentences, but it has to be power-packed story. So you really need to consider your symptoms, your circumstances, and your diagnoses, and try to call the most powerful, relevant information. And so when you are in your doctor's appointments, you describe your story, and you ask how the other person can grant you your wish, your next step. Can you refer me to somebody else? Can you make any recommendations? And so if you're suggesting these drugs, explain to me its benefits and its any problems. So oftentimes, most of the time, you're going to be dismissed, discounted, disrespected one way or another. And so just expect that, because you are being an intelligent, responsible, mature adult, and which is a different caliber than people in this industry are working with. So it's almost like you're there's just something not, like you're kind of this alien, this frightening alien. So there's going to be a lot of interference and obstacles. And this isn't just for doctors. This is if you're working with any big institution. There's these difficulties that are unnecessary, and they're there. So you're going to be prepared to go back to the drawing board. And after you've been, rejected, denied, dismissed, evaded, consider who else can help me, who else can provide answers, and consider the reasons why the first person didn't work. Consider what may not have worked. Perhaps it's you. Maybe you were too tired. Maybe you didn't have clear questions. And also evaluate what did work. Maybe you did have good questions. Maybe you were well rested, well hydrated. Maybe you arrived early or on time. So what worked? And it's important for you to endorse yourself. Also, was the nurse particularly nice, or was the receptionist very nice, or was the doctor remarkably helpful? So what worked? And maybe there was just one little thing that you needed to change. And so again, evaluate what you could have done better, evaluate any mistakes. Maybe you were too stressed. Maybe you had too many questions. Maybe you had too few questions. So what mistakes did you make? What steps did you leave out? And I'm talking about those initial steps. I'm talking about having your goal, knowing who, what, where, when can help you, having your evidence of backup, your questions to reinforce your line of inquiry. Were you able to avoid emotions? And did you have a good story to sum up your diagnoses and symptoms? And did you ask for what you needed? Did you ask them how they can help you? So did you leave any of those steps out that first time? What evidence did you miss? Did you forget to mention that your mom lost all her teeth? And maybe that has to do why your teeth are crumbling, and maybe you forgot that I had all these head injuries, and, even though you were asked 10 times before. So what evidence, what are you forgetting? What have you forgotten to mention? And so now make a note after your evaluation of your first run through, address or make a note of when you plan to address this again, tomorrow, next week, and make a note of what you would want to do differently. So again, this is going to be a review, but it's a good review. And if it sounds familiar, that's good. You're a natural. So again, what is it that you want from this encounter with a doctor or whomever? And who can give you what you're looking for, what you're needing, what resources you need access to? And what do you need to do to provide the information for them or for yourself? Like what documentation, what backup documentation do you need? Medical records, exact dates, times, diagnoses, the exact language. Like doctors like other doctors' language. And make sure you know how to state your case. This is my symptom, this is the diagnoses. It seems reasonable for me to follow up on this, and try, how can you get your doctor or whomever to agree with you, to agree that, well, it seems, your brains are oozing into your sinuses. Maybe we should take a look at that. So try to get them to agree that your request for information or whatever, that it's reasonable. Next one, and possibly the hardest one. So you're maintaining this neutral, robot-like emotionless affect. Okay, so you're devoid of emotion because you're going to lose all credibility if you have any emotion. And you need to be steadfast in light of opposition. So you are going to be evaded, and the doctors or whomever is going to try to control the conversation because you are just a statistic, you are a nuisance, you are a burden on their admin's time because they have to type in insurance codes, and they're trying to get the most amount of money for the numbers that you represent. So you are in charge. You have to advocate for yourself because without your health, you have nothing. Without your quality of life, you have nothing. And you don't have to be a zombie. Like, just because they're happy with you being a zombie or they're content with you being a zombie, like, and they're going to have a life because that's what's more important to them is their life. You are just this thing, this cog, and it's just an unfortunate fact, but there you go. So you have to be steadfast in light of opposition. And so it's good to have some type of spiritual program, some type of self-help program, some type of activity, gardening, or listening to music if you can't handle the spiritual thing. But you need something very powerful. And I would say ideally not relying on intoxicants because that can put you in this box of, where you can't kind of just be, you can't comfortably disclose your situation, especially like if you're really dependent on alcohol, if you're really dependent on pot or something like that, you're probably going to be more hesitant disclosing your issues, the degree, the depth of your addiction. If you're using something that is stigmatized. However, if you're struggling with that, it does seem like that could be an issue. So anyways, even though we're dealing with people who may be seeing you as you're just an illusion in their video game of life, like you're just this paper fiction, tell a heartfelt story. Try to find a balance of telling a heartfelt story. So that's the plan. So now we have some questions. So let's see, we are at 20 minutes. Wow, that went quick. So here's some good questions. See what works well for you. See what seems most relevant to you. So one question I like that to ask, and if you're here, you probably want to know this question too. Do you have many patients with my type of problem? And follow up with that is how many. So when I first had my diagnosis for adrenal insufficiency and low growth hormone, I asked the endocrinologist that, and he's like, 10 patients a year. 10 patients a year is not a lot. So this person is not, like, endocrinologists are probably dealing with out of control diabetes. They're not necessarily dealing with HPA axis dysregulation, which is this whole other ball of wax. It's not blood sugar issues, or mismanaged diabetes. Like mismanaged diabetes is just like this whole other ball of wax. So I would ask, how many patients have you seen with my type of problem? How many? And if your gut instinct is telling you this guy doesn't seem to know much, ask if you can get a referral to a specialist. Unfortunately, there's probably not going to be a specialist in your area, but you could, just keep on asking. Another good question is, how do you usually treat patients with my problem? How do you usually treat patients with my problem? Let's say that together. How do you usually treat patients with my problem? So they're probably going to make some stuff up because they probably haven't experienced your diagnosis very much. So you're asking them to describe the procedure, the tests, the medications, ask how long it would take to notice results, or how long a test or procedure would take. Ask what is the purpose, what is it that you should expect. Are you going to be there in an hour with a needle in your arm, and are they going to inject you with stuff that messes with your blood sugar so you might pass out? Are they going to do a biopsy and forget to tell you, and it's going to be a male doctor who doesn't understand that it can be painful? Ask what are the potential short-term benefits of doing this, long-term benefits. What are the potential short-term harms that could come, or long-term harms, like taking hormones? So if something does go wrong, can it be fixed? Or can I wind up with a bigger problem than the one I started with? And what are alternatives? What are all the actions I could take? Lifestyle changes, other practices to consider, other doctors to consider. And ideally, it's good to see if your doctor is board certified. It's ideal if they could be caring, if they're competent, they're collaborative. And I would like it if they're willing to allow me to think for myself. It's kind of a difficult thing to be a highly intelligent, motivated person dealing with a doctor, because they have great difficulty with that. Maybe ask how long the doctor has been in practice, and sure they love that. Oh, ask what results you can expect and what additional expenses might incur with these procedures or prescriptions. And ask what kind of written information you provide patients with your problem, and ask where they refer patients for additional information. Ask, do they investigate new treatment, new approaches to treatment? Like, for instance, I have multiple gland dysfunction, and they're, medicine, science is learning stuff all the time, and it's a lot of work to stay on top of it. So it's not, but it's nice. It's nice to it almost seems like it's their job to use the most recent information. So ask, about it. Ask if you can speak with other patients who have similar problems as you. And it seems like a good idea to do in general. However, if you're going to do something quite heroic, like brain surgery, I would ask for references, honestly. If you're gonna do something pretty big, where maybe you could lose your limb, quality of life, vision, your life itself, it seems reasonable that you would want to speak to somebody else. So does your doctor do, and these are questions to ask yourself, Does your doctor do a thorough job of physical, mental, and emotional assessment of you, in addition to relying on your blood tests? And does your doctor take your symptoms into consideration, or is the map just the territory? Is the doctor just looking at your lab tests? And this is a good question to ask your doctor. Will your doctor review materials you have brought from your own research? If your doctor is willing to review, if they agree and they're nice about it, that's a great doctor. Email me that doctor's name. This is a great question. Does your doctor ask about your wishes, preferences, and beliefs prior to coming up with a plan? For instance, like I don't want to take drugs, and it seems like doctors think I'm, being a jerk or something for being cautious about taking a bunch of different steroids and hormone replacement therapy. So it's nice if a doctor can respect your concern for your body chemistry, because drugs kill people. It's one of the top 10 causes of death in America. The proper consumption of the correct prescription kills people, or it causes some bad reaction. Ask what kind of dietary changes they would recommend. Ask if they have any training in alternative or complementary medicine. Ask if they do any testing for food allergies and sensitivities. So this is a lot of information, and but it's great. This is like a culmination of probably maybe a dozen years of research. So this is the best that I have to offer, and I hope you use it well and use it often. And feel free to spread the word. So find me at Post-Traumatic Growth on Facebook, and I have a Weiss SAM page called My Post-Traumatic Growth. So I look forward to see you then, and please find me and friend me, email me, so I can keep you abreast of future webinars. Thank you for watching. Bye-bye.